Get started here. Hello, everyone. My name is Caleb Pearson here with Compass Financial Services. I want to thank you for joining us today for our Understanding Medicare and Your Options webinar. I know a few of you or a handful of you were planning to attend here in person, but we had to call an audible here beginning of the week and move it to purely virtual. So thank you for being flexible with that. We have Janice Van On here. You can see her up on the screen there. She's going to be the main presenter today. As you can see, there's going to be a Q&A at the end. So if you have questions either during the presentation or near the end of the presentation, you can email those questions to me, or you respond to the email maybe that I sent the webinar link in, or you can text them to our office line here at 515-327-1020. Also, as a reminder, we are recording this, so if you want to share it after or rewatch it, there's going to be all kinds of information that Janice is going to go over. You can view that recording on our YouTube page, but I'll also send out a link of that recording after today. So please feel free to share that with any family or friends if you feel like they could use the information. So with that, I'm going to introduce Janice here. Janice has been working in this industry for, correct me if I'm wrong, over 20 years, 25 years roughly, just insurance in general. But over the last, she started her business Health Insurance Advisor LLC about 12 years ago. And so she loves coming alongside people and helping them in the health insurance world, whether it's Medicare or individual insurance, small group plans, anything like that. She's happy to help. So she'll go through the presentation today. Again, if you have questions, please send them over my way and I'll make sure we get to those at the end. So Janice, go right ahead.
Perfect. Thanks, Caleb. I really appreciate it. Caleb was telling me as we started this, that there's some of you that this is kind of lunch hour, you're at work, or being able to see that as you migrate into Medicare. So today we're going to talk specifically about Medicare. If you are in that under 65 market and you aren't sure about retirement, can I do it, financial, from a standpoint of health insurance financial, because you're working with Compass on your own personal, my email will be on here or my contact information as well. Reach out, or we can even have a conversation, phone conversation, or in person, and just kind of talk through this so that you can have an idea of what that cost would look like. We can look at comparing COBRA rates. We can, if you've got a retiree plan and what's really out there in the market. Don't go out to the web and go to healthinsurance.anything or healthcare.anything, because you'll start to get a lot of calls. So that's just kind of a precursor to this. Today, what we're going to talk about is the Medicare. So if you will pull up the next slide for me, Caleb, what I want to do is talk through the parts of Medicare, and I hope you all can see that all right. If at the end you want a copy of it, we can certainly send you one. So what I'm putting up here today for you are the 2022 numbers. Now, in your notes, if you're taking any, I'm going to also give you 23 because they are out there right now. And so we'll make some adjustments. The reason I didn't put 23 out there is, I will tell you, I have a concern that the numbers for Medicare may not stay the same. We do have a midterm election, and I'm not being political, but it has happened in the past. So when there's a past history, you know, we like to look past November to make sure everything's the same. All right. So the first thing, if you're taking a note, the first thing I want you to write down is, I'm kind of giving you the visual here. In the middle, I want you to write your birth month. And to the right, let's see, it would be your left. So to your left, put 3 months before that, and to the right, put 3 months after. So if your birth month is January, we're going to go backwards 3, December, November, October. And then you're going to go forward 3, February, March, April. Okay. So those 7 months that we just wrote down, that's called the initial enrollment period. This is the first time that you are eligible for Medicare, turning 65. So the birth month is in the middle. That's when you turn 65. Everybody starts on the first of the month of your birth month, unless you're like me and you're born on the first of the month. We're special, and so we get to start the month ahead. So our initial enrollment period starts a month before our birth month. All right. So we've got 7 months of initial enrollment period, and that's the start time of when we can enroll in Part A and Part B of Medicare. When would we do that? Well, we've already retired and we're not working anymore, so we need to enroll in Medicare. Maybe we have a retiree plan that stops at 65. Maybe we have individual coverage that also stops at 65. So we need to look at that and see when we need to enroll. The time to start that is that 90 days before, or the 3 months ahead of your birth month. Now, here's an asterisk to that. Anybody who is taking Social Security prior to age 65, let's say you started at 62, 3, whatever. Social Security at 120 days before your birth month is going to already create your card. It's the only time that you are automatically opted in to Medicare. And that's because you have Social Security, so they assume you need benefit. Otherwise, the rest of us all have to opt in manually, and there's a way to do that. So when do you reach out to somebody like me, your agent, myself, my office? You reach out about 120 days out, so we find that 90-day window so that we can start the process. If we get to the 3 months after your birth month, it gets very government wonk. And so I'm not going to go through that, but the key is 90 days. That's the next point to write. 90 days before anything's going to happen is a great time to touch base with your agent, me, my staff, so that we can help you set your to-do list and your time frame in order. All right, the other enrollment period is called a special enrollment period. This would be for people who are still working past age 65 and still on employer coverage. Again, the only thing to write down there is 90 days. 90 days before you're going to retire. Or if you're thinking about it before then, 6 months out and you're like, hey, I want to have a conversation. Great. Let's have a conversation to find that 90 days. So remember 90 days. All right. So we're within the enrollment period. We know Medicare is going to start. That's what this sheet is for. So let's go left to right on the sheet, the parts of Medicare. Part A of Medicare deals with inpatient hospital care, skilled nursing, and hospice care. There's no premium for this if you've earned your 40 quarters. That means you've worked 10 years within the United States and earned 40 quarters of paying Medicare taxes out of payroll. So for a minute, we're going to assume we have no other coverage other than Medicare. If you were admitted to the hospital under Medicare and had no other coverage, in 2022, Medicare would pay everything except $1,556. That would be your cost for an inpatient hospital stay. Now, don't think of that as an annual deductible because it's not. It could be per stay if this stay, 60 days, that stay, and they don't relate. So it could be more than once in a year's time. Skilled nursing is the next benefit. This is not custodial or long-term care. This is medically necessary care after an inpatient hospital stay, wound care, rehabilitation after a stroke, intense care that needs to be done, but not at a hospital level. There are 100 lifetime days available of skilled care. Medicare pays the first 20 in full, and then we would have a per day charge after that. In 22, that's $194.50 per day. I didn't mention either the 23 numbers. Inpatient hospital in 23, $1,600, and the per day charge for skilled $200 even, just to give you an idea. And then last under Part A is hospice care. Hospice care, such as doctors, nurses, and prescriptions, are covered in full by Medicare. It's room and board that is not. Okay, so that's Part A of Medicare. Part B of Medicare deals with medical services, doctor's office visits, outpatient surgery or therapy, labs and x-rays, durable medical equipment, and the emergency room. This does have a premium, and in 22, it's $170.10 per month. If you're taking notes, in 23, right now, as of October, it is listed at $164.90. So it did go down. This is one of the numbers that I will confirm or want confirmed after November. All right, your $170.10 monthly premium is income related. So if your income 2 years ago, so we're in 22, let's say in 20, is more than 184,000. Caleb, if you want to go to that next slide for just a minute, because that'll give us that. If your income is above 194,000, this is for 23, you can see, then you would pay more premium for that year. So let's say we're looking at this for 23 and your income for you and a spouse was 250,000. That puts you in that third tier. So your premium for Part B for the 12 months of 23 will be $329.70. And then there's also an income related adjusted amount for prescription drug. These are premiums that are paid to the government. So no matter what, they're paid. Okay. All right. If you want to go back to the last slide where we were, Caleb, thank you. All right. So where that $170.10 per month sits, if you are taking Social Security, that will come out of your Social Security check each month, just as the increased amount would come out monthly if you're taking Social Security benefit. If you are not, Medicare and through Social Security will bill you quarterly. So $170.10 times 3. I will tell you that once you have signed up for Medicare, Medicare.gov has a great billing tab now, and it is viable to set that up monthly or use a credit card when you're not taking Social Security benefit. That's one of the things that's our job to learn and know, and so we're here for you to help with that. All right. With that then, for those services listed under Part B, there is an annual deductible. In 22, it's $233. In 23, it is going down to $226. You will meet that deductible with the services listed above. Once you've met that, then Medicare pays 80% and you pay 20% until the end of the calendar year. So these are our basic benefits in Medicare. How do we cover those expenses? We have two very distinct ways to do that. The next column, the middle column there, is the more traditional way, Medicare supplement or Medigap policies. These are policies that fill in where we have expense under Part A and B that we just talked about. Now, if you turned 65 before January of 2020, then you are eligible for the shaded box or Plan F. If you are turning 65 after January of 20, or coming up, the rest of us, our X generation, and those of us turning 65, we are not eligible. So we are eligible for Plan G as our most comprehensive plan. I'm going to explain Plan G first, and you'll understand why. So Plan G, for those of us that are still too young for F, Plan G says you pay for the medical services under Part B until you meet the annual deductible, $233, or in 23, $226. We owe that. And then after that, Plan G picks up the 20% under Part B and all the expenses under Part A. To go back up to Plan F, what's the difference? The Part B deductible, the $233. That's it. The only difference. Okay. Now there's a blank line up there you can see for a female turning 65 about now, October of 22. You can estimate premium to be $82 to about $124 a month. In that range I just gave you are 6 carriers that I work with. And so we talk about the carrier, their historical increases, why they're different, and how they are with business. For a male age 65 is going to be $93 to about $140 a month in premium. Now realize in aging in, you are guaranteed no medical questions and you are guaranteed no tobacco. So you are getting a preferred non-tobacco rate as you age into Medicare. After that, on a Medicare supplement, I want to change carrier or change plans, I have to answer medical questions. Okay, no matter when I make that change. All right, I know you don't have the sheet in front of you, but I'm giving you the visual. So the Medicare supplement box, we draw an arch over to the prescription drug box and connect the two. And the reason we do that is because Part D, prescription drug coverage, is not offered in a Medicare supplement. There's no retail prescription drug coverage. So we have to purchase a prescription drug plan. The plans have the same design. So what you see in this presentation under the $6 to $50 premium range, every carrier has to work within that range. This is why it's a part of Medicare for prescription, is because Medicare sets the rules and the carriers have to abide by it. So there may or may not be a deductible on a plan. There will be different copays and all up to the coverage gap. I want to explain the coverage gap a little bit because the donut or the coverage gap has always been really difficult for everyone. Well, it was created by the government. It's difficult. All right. So I want to use a prescription that retail cost is $500. So on the left side of your piece of paper, I want you to write $500. And on the right side, the first thing you're going to write is a $500 deductible. So the first time we purchase that prescription, we pay for it. After that, the next month we buy it, we pay a $47 copay. But $500 adds up over here retail. The third month, $500 retail, $47. Over here on retail, we're going to add up until we meet $4,600. At about $4,600, and I'm rounding here for you, is when we hit the coverage gap. So we pay copays all the way to about 8 months. And then we'd hit a coverage gap where at that point, we pay 25% of the cost of the drug. So about $125. That's what the coverage gap is. That has been closed down to the 25%. In 2010, up to 2010, it was 100%. Now it's down to 25. In addition, some of the changes that have happened, there is an insulin program where the insulin savings program now states that an insulin cannot cost more than $35 a month. If you're looking around Medicare drug plans, you might see a new tier 6, and that relates to the insulin savings program. All right, that's as deep as I'm going to go on that. So between your Part B premium, $170.10, a supplement premium for Plan G, $100 rounding, and your prescription coverage, rounding to 20, 25, just a bit of middle plan. You can budget, as we know it today, at about $325 to $350 a month for your premiums. And you'll have very little medical expense because the only out-of-pocket cost is that Part B deductible if you're on Plan G. Okay. I know it's a lot. I'm glad this is recorded so you could take notes now and go back and go, what did she say? And watch it again. So Caleb, thanks for recording this for us. All right. We've got the other way that we can have coverage then. So we use The other opportunity for coverage is Part C, Medicare Advantage plans is the general term for this. Medicare Advantage plans replace the use of original Medicare. We don't utilize Part A and B when we have a Medicare Advantage plan. Now, the first thing people say is, well, do I have to pay that premium then, the 170.10? Yes, we always have to pay premiums to the government. And the reason is because the government gives the Medicare Advantage carrier a stipend to take care of you. So that's part of the stipend that's paid. All right, let's go to that middle column. Typically, there's very little to no premium. Most of the plans I like are zero premium. Why is it zero premium? Because we're going to pay when we use services. There is a network of doctors. And one of the things that I think you'll hear from people who've retired previously is you don't want an Advantage plan because the network is too narrow. I'll agree. There are some networks that are one healthcare system only. I don't normally sell those. And the reason is because if I can give you a zero premium plan and give you a broader network, I mean, unless there's a specific reason, I don't see a reason to be that narrow. So I have carriers that have in-network benefit with a PPO out-of-network benefit. And the out-of-network benefit definition is this. As long as a provider or facility accept Medicare, so think back to Part A and B. If they accept Medicare, they have to accept your Advantage plan at a minimum out-of-network benefit. We've now become very broad in the Medicare Advantage market. We have carriers that have Mayo Clinic in network. So don't discount it. I realize it's completely different thought process, but at least hear the person out when you're talking, or hear us out when we're talking about it, because we want to make sure you have quality information. All right, so back into the plan. Not paying a premium, network of providers. What happens? Think of it as a listing of co-payments of cost. Typically, there's not a deductible. So it's not, I have to pay all this and then they cover. It is primary care visit, $0 or $10. Specialist visit, $30 to $40. Under a Medicare Advantage plan, inpatient hospitalization is different than anything we've ever experienced through an employer. It's a per day charge for so many days of a stay. So for ease, let's just say $400 for 4 days. If I stay beyond the 4-day limit, I'm still only paying to day 4, and that pays everything for that inpatient hospital stay. If I go back in again and I stay another 4 days, I'm paying it again. Physical therapy has a copay. Outpatient services. I need a knee replacement. That knee replacement is deemed outpatient now, and you're looking at $325 for a knee replacement and $40 a visit for physical therapy after. All of these costs add up to an out-of-pocket maximum. It's right there above the heavy line. So add up all the costs. If I hit $4,000 a year, then the carrier will pay 100% for the remainder of the calendar year. Bundled with that, but not applying to the medical coverage, is prescription drug coverage. Designed as the standalone prescription drug is, because they have to be the same. So ultimately, here's what we're going to talk about. I'm either going to pay a premium to have very little medical expense each year, or I'm not going to pay a premium and I'm going to risk the $4,000. Well, it's not $0 to $4,000. When you're looking at that, you have to take, if I were to pay this premium and if I risk $4,000, and what's that corridor? And does that corridor of risk bother me? Now, there's some other things we could go into about enrollment periods and back and forth and times like that. I think that's something we should do when we get into a personal appointment, because although in my world, There's not a lot of difference. I want to talk to you about your personal situation. And so I want to hear your stories so that then we can tailor this and answer questions for you. That said, we can certainly talk about general questions now if anyone has any.
Great, thanks, Janice. That brought up a question. We were kind of talking about this before we hopped on the webinar here, but we're all seeing the commercials from Joe Namath, and you mentioned Medicare Man and all of this. So, of course, people are, they see those things on TV. It's like, oh, maybe I should give them a call. Maybe we'll see if they could offer me something different than what my current agent is giving me. Can you kind of describe the difference between how you work and companies like that work, just so people kind of understand the difference?
Sure. So first of all, we're independent, we're agents of the companies that we represent. And so we're commissioned agents. It's not, there isn't anybody in our business that works on a fee basis. So for example, if a client came in and talked with us and then went to another agent to write their business, that agent gets paid. I don't get paid for my time. So we're commissioned agents. So let's go to the commercials. Those are great. Yeah. And Medicare Man's the new one out this year that I've seen. And wow, you know, as a licensed professional, that's who I want representing me. But what they're doing is oftentimes they're saying, let us see if you can get your Part B premium back. And there is, at a certain level of income, low income, there is the ability to get your premium back. And briefly, what that means is there are 5 levels of Medicaid or low income assistance. You have to be here or more before you get your Part B premium back. So if you have assets, if you have a home, a car, you know, retirement, you probably don't qualify. So then what they're going to do is go, oh, well, here's what's available in your area along the lines of the Advantage plans. But in my opinion, they're kind of degrading that because they're selling, they're not educating about the differences and about what best fits you and about what you're comfortable with. The main purpose of my job is to make sure that you have a plan that you're comfortable with, not what I want to sell you.
Great, thank you. Had a question come in, and you kind of touched on this a little bit, but how do you decide between, you know, going with a supplemental plan versus a Medicare Advantage? I know you talked about deciding the dollar amount between the $4,000 maximum out of pocket versus just the monthly premium and everything, but what are some other things to consider when deciding between those two?
Yeah, great question. Other things that people bring up for the differences, I'm going to be traveling. I just had a couple who said, you know, we're in the process of purchasing an RV and we're going to be around the United States. And, you know, they may not just be vacationing in Arizona or vacationing in Florida. They're going to be out and about. So to them, it seems more comfortable to have a supplement, because a Medicare supplement, remember, you're paying based on what parts A and B cover. So a Medicare supplement says, as long as Medicare allows and pays a portion, the supplement has to pay. And as long as a provider or a facility accept Medicare, they have to accept your supplement. So there's no worry about having, do I need to make sure this person's a network? Do I need to make sure I have a plan that allows me to see these people? So oftentimes that comfort of, hey, I'm, you know, in my go years, I'm just retired, I'm in my go years, I'm going to be going. I think a supplement fits my budget and it fits my comfort as to where I'll be and what I'm going to be doing. In the same respect, others might say, okay, I have people come in that say, why isn't everyone on Advantage? This is the best thing in the world. Because they don't think like you. And so everybody's opinion is different for what's personal to them. And so we look at comfort as the utmost first, because I don't want you waking up at midnight worrying about what you have for health insurance. I want to make sure I gave you good quality information so that you can make a good decision, but ultimately comfort.
Great, thanks. Another question is, talk a little bit about pharmacies and how important picking the right drug plan might be for that.
Yeah, sure. So in 22, there's 22 plans available through about 8 carriers. In 23, as we migrate into that here starting Saturday for the annual enrollment period, we've got 24 plans. So it is important to know what pharmacy you use. Again, think of that person that's traveling around the country in the RV. They like Walgreens because if they're in California and they get a crud, you can hear it in my voice. If they get a crud, they've got a Walgreens. If they're in Utah, they've got a Walgreens. That could be important. So we want to make sure that we utilize a plan in our initial enrollment or every fall from October 15th to December 7th, hard dates every year. We have the opportunity for people enrolled in Medicare to look at the next calendar year for a change in their prescription drug plan. So we have people who maybe email us their list and say, hey, just be sure. This year into next, for 23, we know we have a carrier that has taken a pharmacy and taken them from preferred to standard. So people are asking us to look and see if there's something else that would be more cost effective. Every fall is an opportunity to look at the prescription drug plan. Now, you don't have a change. Your carrier premium went down. You don't have to do anything for that to continue to the next year. So it is important. The biggest piece, I think, for consumers is September 15th to 30th every year is when your prescription drug carrier has to send the annual notice of change. We need you to participate. We're not making a decision for anyone or telling anyone what to do. You need to participate. So getting that annual notice of change, seeing if that still fits you, have your prescriptions changed, has the pharmacy changed, has the cost changed from a premium standpoint. That's what we're here in this fourth quarter to help you look through.
Great, thanks. Another question that I just kind of thought of is, as far as those income ranges and limits go, we have a lot of clients who wait till 65 to retire. And what do they use to look at that income or verify that income? Was it a previous year's tax return? Is that how they do it?
Yep, great question. So when someone is coming into Medicare at any point, what Medicare is going to look at is 2 years prior. And they will always 2 years prior, and they'll look at the modified adjusted gross. Okay, so before taxes, before your personal deduction. So they'll look at that, and every December thereafter, they review it 2 years back. So Social Security and the IRS have the bat phone to each other, and they go back, they know to look. And so if your income changes as you age further into Medicare, that premium could change down to the base premium or go higher. If we have one off, so someone sells the farm 1 year, theirs could go higher. There is an appeal process for that. We can talk about that. But every December that will be reviewed. And then you get kind of that scroll. It's kind of like the corner on the Wizard of Oz. He comes out and scrolls, and that's kind of what your statement is from Social Security after that first year of being in it. And they say, here's the new benefit. Here's the Part B premium. Oh, we checked your income. Now you're paying this. Here's your deposit on the third Wednesday of every month.
Okay, great. Then I got one more question here that looks like came in. If anyone else has any questions, we're going to wrap up here shortly, but this is maybe more of a specific question. So if you can't answer it, I get that. But someone said, I currently have a Amerigroup. What kind of Medicare do you usually recommend for this situation?
Amerigroup. Okay, so if it's Amerigroup, I'm going to determine that they could be or know of someone who is Medicare, Medicaid eligible. And if that's the case, then that's called a dual eligibility. And there are plans out there for that specific market, very specialized in that for Medicare, Medicaid, if that's what we're talking about. If Amerigroup is something else, then if you could write back in again and tell me that I'm off base. But there are definitely specialized plans and opportunities within different income levels when it is in that. Remember, I talked about the 5 levels of Medicaid, and it's within that.
Okay, thanks. Yeah, and I may connect you guys after the
Sure.
presentation here just to get more clarity there. But other than that, I don't see anything else that's come in at the moment. So if you do have questions that come in after, I'll make sure we connect you with Janice so you can discuss it with that. Actually, hold on, one more just came in. Can you take Advantage plan, then change it if it doesn't work for you?
Yeah, that's a great question. So there's a couple of things. If you were on the Advantage plan, aging in, so I'm going to keep using this, we're aging into Medicare, and it's the first time you've been on an Advantage plan, and you are within 10 months of signing up. So just for ease, let's say we signed up because our birth month is January, and we're coming up on October 31st. Anytime in the first 10 months of being on Advantage, I can change with no medical questions. Now, let's say I go beyond 10 months and I'm on Advantage, and it's 3 years down the road. My father was this. He was like, yeah, I'm kind of playing the float. Maybe I should change to a supplement now because I haven't been sick. I've saved some money. But so at that point, he would have to answer medical questions because he's outside of this once in a lifetime trial period. So can you change? Yes. Are medical questions going to happen? Most likely, I would say, more often than not. So that's, again, a conversation to have and say, you know, what are we trying to do? If someone is on Advantage, has a diagnosis and wants to switch, possibly not, because Medicare supplement plans were written with language from 1980s. And it says you can change your supplement anytime you want to, but you have to answer medical questions. And if we're not in that trial period on Advantage, we have to do that as well.
Okay, thank you for that. And I just got another one that came in. It's more of a comment, but you can maybe discuss this a little bit more about SHIP. SHIP volunteers they can explain Medicare provisions and plan options, but cannot recommend a specific insurance company or agent. If seeking a MedSup plan, consult an independent agent that sells for more than one company or plan and may be beneficial. So that makes sense, but can you kind of explain what SHIP is and what
Sure.
it can do for people?
Yep. SHIP are senior health insurance. I'm not sure about the 2 P's, something people. Anyway, just what Caleb said, they are volunteers. And so these are people who have either experienced Medicare, have taken the time to learn about it, and they volunteer their time in specific kind of landing in a specific place. So I know of a SHIP volunteer who was at Broadlawns. Others are at different hospital or library or churches or things like that. And that's exactly what they are volunteers. So they can look at Medicare.gov for you to look at prescription drug plans and Medicare Advantage plans. They can tell you about the differences. Again, they are not a licensed agent, so should not be or aren't giving opinion, and should direct you to an agent. They do have booklets about different things, kind of giving you a range for premiums of the plans and of the carriers that offer supplements in the area. It's very general. So it's a good starting point. If you're just nowhere or you're confused and you kind of want to ease into it, they're a great opportunity for information. You know, realize here's the biggest piece. For us humans, it takes us 3 to 7 times to learn something that's hard. And this is hard. And we know it takes more than once. I've met with people 2, 3, 5 times before they make a decision, simply because it's hard. It's not something to take lightly. So SHIP volunteers starting to hear the information once, hear it and see it like we did here today, another time, you know, you're getting towards 3 pretty quick, and it starts to become more comfortable.
Mm-hmm. And just like anything in this case specifically, I mean, most people go through this process, and just because it may work for one specific person's life and style and their drugs that they're taking and all of that doesn't mean it's going to work the same for another person, right? And so I like that everybody's situation is different, and that's why you want to have those discussions with people and just say, hey, these are what your options are. These are the ways that we may lean, but everybody's situation is a little bit different.
Yep. And I'm one of those people too. Maybe you come in and you've got your arms crossed and you say, I don't want Medicare Advantage. Totally can appreciate that. I'm going to share some basic information simply so that when you go have coffee with Sweet Susie, that you all can have a good conversation about it and not have it be, angry or defensive saying why or why not. You've got good information. So we always try to make sure that we're giving the full breadth of everything so that the comfort can be found.
Good. All right, last one, and then we'll call it here. Just a confirmation. Premium for 2023 Plan B is based off of modified adjusted gross income shown on your 2021 federal tax return.
If you have that increase, yeah. So that sheet that I presented here with the red lines, Caleb has it. You can fire that out. It's just general information. You can find it at medicare.gov. So yep, that information's out there. This is the 423 as we know it today, because again, I'm not thinking it's going to change, but that 164.90, that base premium is what could change. And then this all could be upended, but this is going to give you a good idea. And then they will review it. And then in the fall of, December of 23 for 24, they will look at 22. So they're always stepping with the 2-year look back.
Okay, great. Yeah, so for everyone who's still on here, I'll make sure to send out the recording, and I'll include this PowerPoint that has these couple of slides that we looked at today on that as well, just for you to reference again and keep with your notes. So with that being said, Janice, thank you very much for hopping on today, and glad it worked out. You got a busy couple months coming up here starting Saturday, so good luck with all of that. But again, I'll put her contact information. If you have any questions specifically for Janice, you can reach her. There's her phone number and her email address. I'll include that in the email as well, just for ease's sake. So
Perfect.
thank you
Thanks,
again,
everybody.
Janice. Yep, have a good one. Thank you.
You as well.